Our loved ones fought for us, put their lives on the line for us, and now they're suffering from post-traumatic stress disorder. Let's talk about it.
Welcome to My Healthy Mind. I'm Elizabeth Atkins, and this is my co-host, Michael Hunter. My Healthy Mind is all about shattering stigmas. Our goal is to talk about topics that are taboo, things like obesity, mental illness, addiction, human trafficking, abuse, things that make us feel ashamed, afraid, embarrassed. But in order to heal from these problems, we have to talk about them. So our mission here is to bring them out into the open and feature experts who can provide the resources that you might need to learn how to get help and how to heal. We also showcase regular people who have triumphed over these tremendous challenges that could have crushed them, but instead made them stronger and inspired them to reach out and help others. So today's show is all about that. And Michael, what's our topic?
Today we're going to talk about post-traumatic stress disorder. Our guest is Dr. Bella Shanzer, who is the Chief Mental Health at the John Dingell Veterans Administrative Medical Center in Detroit. She's going to give us her expert view on what is going on when someone is suffering from post-traumatic stress disorder and what we can do to help get that person into treatment, as well as what we can do to support that person as they are dealing with it. And it is so relevant with the number of veterans that we have in our lives today.
Excellent. I'm so looking forward to that. And who's the guest?
The guest is Ulysses Spencer, a person who is triumphing over that disorder today. He has a very compelling story about being in Vietnam and what happened to him, and it will just draw you in as you begin to really sympathize with him and empathize his position, and knowing that you know so many people who've suffered from this disorder. So today's show is great. Don't go away. We'll be right back.
I was feeling so alone.
I was going through a really difficult time.
I didn't want to bother anyone.
I didn't think they'd understand.
It was tough at first, but I did it.
I'm glad I asked for help.
I asked my teacher.
I asked my dad.
You can do this.
Whatever it is, ask for help.
If you're thinking about suicide or need support, call the Trevor Lifeline. Trained counselors are there to help 24/7.
We are this close.
We're this close.
We are this close. Of uncertainty.
To making history. This close to changing the world.
We're this close.
This close. This close to making sure no child suffers a crippling disease
Ever again.
This close. We are this close to ending polio.
Ending polio. All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
It began with my big toe. That was my first amputation that I had.
Berger's disease, it's a vascular disease brought on by smoking.
My fingers started to go piece by piece.
First, it was my left leg. After my left leg, it was my right leg. And so now I'm a double amputee, all from smoking.
My tip to everyone is, don't believe that this can't happen to you, because it can.
You can quit. For free help, call 1-800-QUIT-NOW.
Operación de corazón abierto para salvar mi vida. Tenía 33 años cuando me enteré que tenía una enfermedad del corazón. Y estaba bien sorprendida porque yo era una persona bien saludable. Lo primero que pensé eran de mis hijos, que yo no iba a estar aquí para mirarlos crecer. Oigan su propio cuerpo. Estoy participando en Go Red por tu corazón para informarle a todas las mujeres que tengan conciencia de su propio corazón.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Welcome back to My Healthy Mind. Today we're talking about post-traumatic stress disorder and how it's impacting our loved ones. And today we're going to have a great conversation with Dr. Bella Shanzer, who is the Chief of Mental Health at the John Dingell Veterans Administrative Medical Center in Detroit. Welcome.
Thank you. Thank you for having me.
When I hear post-traumatic stress disorder, I think about Vietnam, Afghanistan, war in general, and some of the things that I just, anecdotally have seen or heard about the disorder. Tell me how to relate that to what's going on in our society today from a practical standpoint.
Sure. So PTSD, post-traumatic stress disorder, is obviously very common in our veteran population, but it's also, unfortunately, increasingly common in our non-veterans, everybody in the United States. So in our veteran population, roughly 15 to 20% of veterans will suffer from PTSD at some point. However, in the non-veteran population, about 4% of men and 10% of women suffer from PTSD at any given time because anybody can develop PTSD who's been exposed to a trauma, either they themselves, a loved one, even those people who've been exposed to repeated traumatic type things like first responders after 9/11. They can develop PTSD as well. So while it's very common in our veteran population and we're working very, very hard to address it amongst our veterans, it's really a problem that we all need to deal with because anybody is at risk for developing PTSD.
Can you tell us what are the symptoms of PTSD and how does it manifest?
Sure. So, and ironically, the American Psychiatric Association has recently revised the diagnostic manual, our DSM, and PTSD was one of the diagnoses that was revised. So there are 4 symptom clusters. They are avoidance, and avoidance are when people essentially keep themselves away from memories of the trauma. They avoid going to places. It's like when you have a breakup, a really bad breakup, and you won't go to that restaurant because that's where you always went to with your previous boyfriend. That's avoidance, really trying to keep the memories at bay. A second symptom cluster is negative emotions and cognitions. These are feelings of worthlessness, helplessness, guilt, feeling anhedonic, and that means lacking interest in things that you used to enjoy doing. And that's very, very pervasive amongst our veteran population who suffer from post-traumatic stress disorder. A third symptom cluster is hyperarousal. And this is the symptom cluster that oftentimes really brings people into treatment and is what we read about in the paper. This is irritability and anger and almost overwhelming rage where you really can't control your response to it. You're hypervigilant, you're looking around, you're always afraid that something's gonna happen. I have a patient who can't drive down the street because every time he sees a garbage pile, he's afraid that a bomb is gonna go off. He can't get past the fact that he's safe now. The fourth symptom cluster is intrusive thoughts. This is re-experiencing. Nightmares is one of the most common symptoms in this cluster. And you hear this as a very common complaint. During the day, they can keep it together, but at night, the symptoms come back and they're presented as nightmares. And it's really, really tough because they can't sleep. That makes them more irritable.
And if they are experiencing post-traumatic stress disorder, when we see that in someone, and if we don't steer them towards getting some help, what can be the outcome?
So this is really the thing that we struggle with the most. So post-traumatic stress disorder is horrible in and of itself. It really prevents somebody from having a good quality of life. I mean, you can imagine how difficult it is to be a good father, a good husband, a good wife when you're feeling angry and irritable and you can't sleep and you're afraid to leave your house. It's almost impossible to function. But in addition to that, post-traumatic stress disorder is oftentimes comorbid. That means it goes along with other issues such as substance abuse. About 46% of individuals who suffer from PTSD also have a substance use disorder. And that's a staggering statistic. In addition, unfortunately, it's also associated with suicide, and PTSD is its own risk factor for suicide. And as you know, suicide is one of the most difficult problems that we're struggling with amongst our veteran population. On any given day, 18 veterans die from suicide, and every month 950 veterans attempt suicide. Just to give you a perspective of how immense the problem is, about 38 out of 100,000 veterans will die every year from suicide, as compared to only 4 out of 100,000, 19 out of 100,000 amongst the general population. Essentially, there's twice as many suicides amongst men, 3 times as many suicide amongst women, comparing the veteran population to non-veteran population. It's almost an epidemic in terms of the proportion of size. So that is the problem. Is that PTSD is difficult in and of itself, but it's associated with these other very, very serious issues. And when somebody is struggling and they're drinking, they start to spiral to a place where it becomes almost impossible to reach them. And that's where the VA steps in. And we've really tried incredibly hard to reach every veteran. We've invested a tremendous amount of money in research. Right now, the VA has proponents of what we call evidence-based therapy. And these are therapies that have been studied in randomized, double-blind controlled trials that are really considered the gold standard for treatment. 2 of the most effective treatments are prolonged exposure, which is a cognitive-based approach in which the veteran talks through and exposes themselves again to the trauma, but in a safe environment, in the safety of their therapist's office. The other one is called cognitive processing therapy, and in a similar manner, essentially, we work to change the cognitions, the thoughts that the veteran is having so that they feel safe again, and so they no longer feel worthless, they no longer feel the guilt that's associated with the trauma. And finally, of course, there are medications. And the VA has helped with supporting a number of the trials to determine which medications are the safest. We know that SSRIs, which the most famous one is Prozac, but in this case, really any of the SSRIs, sertraline, citalopram, are effective. One thing that's not effective that I think is really important for the veterans out there to know about are that benzodiazepines are not effective in treating PTSD, and that's really a myth. People request benzodiazepines oftentimes, and in fact, the studies have shown that they actually worsen PTSD symptoms. And it's really important for people to understand that so that they can have a knowledgeable conversation with their psychiatrist and their therapist so they can get the help that they need. And we want every veteran to come in. If you're the loved one of a veteran, encourage them to come in. The only way that people can get better is if they come for help. And we really want every veteran to take advantage of all of the resources that we have to help them.
Thank you, Dr. Shanzer. Coming up after this break, we're going to talk with a man who's living with post-traumatic stress disorder, and we're going to learn how he's helping others.
I was feeling so alone.
I was going through a really difficult time.
I didn't want to bother anyone.
I didn't think they'd understand.
It was tough at first, but I did it.
I'm glad I asked for help.
I asked my teacher.
I asked my dad.
You can do this.
Whatever it is, ask for help.
If you're thinking about suicide or need support, call the Trevor Lifeline. Trained counselors are there to help 24/7.
We are this close.
We're this close.
We are this close. Of unwanting tea.
To making history. This close to changing the world.
We are this close.
This close. This close to making sure no child suffers a crippling disease
Ever again.
This close. We are this close to ending polio.
Ending polio. All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
It began with my big toe. That was my first amputation that I had.
Berger's disease, it's a vascular disease brought on by smoking.
My fingers started to go piece by piece.
First it was my left leg. After my left leg, it was my right leg. And so now I'm a double amputee, all from smoking.
My tip to everyone is, don't believe that this can't happen to you, because it can.
You can quit. For free help, call 1-800-QUIT-NOW.
Operación de corazón abierto para salvar mi vida. Tenía 33 años cuando me enteré que tenía una enfermedad del corazón. Y estaba bien sorprendida porque yo era una persona bien saludable. Lo primero que pensé eran de mis hijos, que yo no iba a estar aquí para mirarlos crecer. Oigan su propio cuerpo. Estoy participando en Go Red por tu corazón para informarle a todas las mujeres que tengan conciencia de su propio corazón.
Stress, Depression and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Welcome back to My Healthy Mind. We're here with Dr. Shanzler, and we're joined by Ulysses Spencer, who's living with post-traumatic stress disorder. Thank you for joining us.
Oh, your pleasure.
Can you please tell us how you got post-traumatic stress disorder and how it manifested in your life?
Oh, without a doubt, it did manifest. I'm a United States Air Force veteran. I served in the Vietnam War from 1970 to 1974. I was just 18 at the time, and I was on combat support missions all over the world, mainly Vietnam at the time. My job was to take troops and cargo into the combat zone, and on the return trips was the problem. Bad evacuations, the wounded, sick, soldiers, and watching them die on the return flight out just was overwhelming. Also, the human remains, bringing them home. It didn't bother me at first. It came on gradually. Every time the phone rang of another mission, I had to leave the States and go back and forth, back and forth, back and forth. I covered it up the best I could. I even was married at the time. My wife was a veteran. I wonder what she went through, thinking about, was I going to come home? So most of the time I prepared myself to not come home. All my emotions, feelings, fear, anger, love, I put on the back burner and followed my orders, did my duty. When I returned home in 1974, it was actually my mother that noticed something was wrong. She looked at me and took me into a room and started saying if my arms and legs was there. And she said, son, I said, I'm home, Mom, I'm okay. She said, you hear some, but you're not here. I never understood what she was talking about until 2008, when my sister and my brother-in-law brought me into the VA. I had been homeless for a while. I was on alcohol and drugs, crack cocaine at the time. I was in my late 40s, early 50s when I was on drugs. And she brought me to the VA, and I met this social worker. And when I walked in, she took me by the arms, and she said, welcome home, soldier. I never heard that word in my life. Being a Vietnam veteran, we wasn't welcome home. And when she said that, I broke down and I cried. I haven't cried since I was 18 years old. I was admitted, put on the ward there at the VA, B2 North. I was diagnosed with post-traumatic stress disorder, major depression, alcohol, and substance abuse. And I was up there on the ward for a while. And after a few weeks, I started talking because the psychiatrist pointed out things that bothered me all my life. Sleepless nights, certain smells, certain sounds. And I didn't have any drugs or alcohol in me. And I still had these same thoughts and nightmares. From that point on, I knew I needed help.
And Dr. Shanzler, he said something very interesting. He said that it was happening before he got home, and he was hiding it. So I always thought about it as something that happened after veterans arrived back in the States, but it was happening before then. Is that common?
Yes, and unfortunately, a lot of our veterans start suffering while they're still in service, and but they have to just keep doing their job. So they're maybe given a pill so things will keep it together, and it's not until they come back that things start to really devolve, because all of a sudden they're not being told what to do anymore. Now they're sitting at home, and then they're waiting at home, and things are just getting worse and worse. And that's when it really becomes a problem.
And how does it become a problem?
So your dad isn't sleeping. He's angry all the time. The littlest things will tick him off. Daddy's not daddy anymore. They have trouble being intimate. They have trouble going out to restaurants. They have trouble sitting in a movie theater. I have a veteran who literally can't go to the imagine the movies, right? That's one of the most common things we do as Americans.
Never went.
He can't go to the movies because he's worried that something's going to happen. They have trouble driving down the street because they're worried that bombs are going to go off. They have trouble going into Walmart or any other supermarket because of the crowds, and they're worried that something's going to happen. They can't function as a regular person. They can't function as a regular member of their family and society. They can't work. And then it just gets worse and worse because they become socially isolated. They start drinking. The dark thoughts start coming. And then it becomes harder and harder to get them back. That's why it's so important for loved ones to reach out and get them help the minute they start noticing. I mean, I think Mr. Spencer's story of his mom is so on point because that's oftentimes the people who reach out to us are the loved ones. We get a letter from a wife. Something's wrong with my husband. He's not the same. That's exactly the words they'll use. He's not the same. She's different than she was before she went. They are not psychiatrists. They don't know how to articulate. They can't diagnose, but they know something's off. The minute they feel that way, that's when they need to bring their loved one in.
I agree.
The minute the veteran starts feeling that he doesn't like the fact that he's yelling at his kids all the time. That's one of the complaints that brought one of my patients in. He noticed that he was yelling at his children more than he wanted to be. That's when you come in for help.
So how do we do, or what do we do to keep somebody from waiting 30 years to come and get that help as opposed to, waiting that long?
So first, thank God, the country is not where we were after Vietnam. I mean, obviously, we owe our Vietnam veterans an apology that we can never really completely complete. But the military and the VA have been very proactive in terms of reaching out to our returning veterans. The media has been a great partner to us in terms of getting the message out. They have to come in. And if I'm a loved one, this is what I'm seeing. I'm seeing somebody who's staying by themselves, isolating. They're getting angry for no reason. They used to be fine playing catch with their son, and then all of a sudden the son drops the ball and they fly off the handle. It's the little things, and you hear it from the significant others. They're just not the way they used to be. Don't wait. If you see that, if you have that feeling that your significant other, your son, your daughter, your husband, your wife, your father, is just not the way they used to be, have them come in and talk to somebody. We're not going to drug people up. We're not going to hospitalize people. We want to help. The first step is just coming in the door. We have services. They can be seen literally 24/7. Anybody can be seen in our emergency room at any time. But preferably, the best way to get help is to come during the day, and they can be seen the same day. Anybody who has a mental health problem can walk into the John D. Dingle VA and be seen that day. If you can convince your loved one to come in, bring them in that moment. Don't wait till tomorrow. Come now, and you will be seen by a psychologist or a social worker. You can be seen by a psychiatrist. And you will get the help that you so desperately need. And we work with the veteran. So wherever the person is, if they want to just get support, we'll give them support. If they want to get group therapy, individual therapy, if they want to be on medication, we'll meet them wherever they are. That's really our focus, is recovery oriented. We want to help people get back the quality of life that they so desperately deserve. I mean, we have to remember these are men and women who sacrificed for us. Our country is free because of our veterans. It's the least we can do is to offer them every bit of assistance that they so desperately need. So if you're a loved one, if you have any concerns, you can always just call. You can call the Veterans Crisis Line. That number is 1-800-273-TALK. And then you press number 1 for veterans. So even if you have a concern and you're not sure, call the crisis line. They can tell you the resources that are available. They can help you come in. But please, if you have a loved one or if you yourself are suffering, don't wait 30 years. Come in today so that you can get better and that you can get back to life.
Dr. Shanzler and Mr. Spencer, thank you so very much for this very powerful conversation that can help so many people. And coming up after the break, we are going to learn more resources that can help people with post-traumatic stress disorder.
I was feeling so alone.
I was going through a really difficult time.
I didn't want to bother anyone.
I didn't think they'd understand.
It was tough at first, but I did it.
I'm glad I asked for help.
I asked my teacher.
I asked my dad.
You can do this.
Whatever it is, ask for help.
If you're thinking about suicide or need support, call the Trevor Lifeline. Trained counselors are there to help 24/7.
We are this close.
We're this close. We are this close.
Of unwanting
To making history. This close to changing the world.
We are this close.
This close. This close to making sure no child suffers a crippling disease
ever again. This close.
We are this close to ending polio.
Ending polio. All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
It began with my big toe. That was my first amputation that I had.
Berger's disease, it's a vascular disease brought on by smoking.
My fingers started to go piece by piece.
First it was my left leg. After my left leg, it was my right leg. And so now I'm a double amputee, all from smoking.
My tip to everyone is, don't believe that this can't happen to you, because it can.
You can quit. For free help, call 1-800-QUIT-NOW.
Operación de corazón abierto para salvar mi vida. Tenía 33 años cuando me enteré que tenía una enfermedad del corazón. Y estaba bien sorprendida porque yo era una persona bien saludable. Lo primero que pensé eran de mis hijos, que yo no iba a estar aquí para mirarlos crecer. Oigan su propio cuerpo. Estoy participando en Go Red por tu corazón para informarle a todas las mujeres que tengan conciencia de su propio corazón.
Welcome back to My Healthy Mind. Well, Elizabeth, another great show.
Yes.
Tell us what you got from it today.
Well, when Mr. Spencer was talking and telling his story, and he said the nurse greeted him at the hospital saying, "Welcome home, soldier," and nobody in 30 or 40 years had said that to him, that just gave me chills.
That was very moving.
My goodness. And his whole story was so overwhelming with emotion and history and the dilemma that so many veterans have faced. So it was just chilling to listen. But the beauty is he got the help, and now he's helping other people.
Absolutely. And one of the most moving things to me was when Ulysses said that his symptoms actually began while he was still enlisted, while he was still on the battlefield. And I never put that together because I hear the word post and I'm thinking it's something that happened when they come home. But the symptoms were there all along. And imagine living with it for so long. But I'm really thankful to him and the other men and women that serve our country so that we can have the freedoms we have. And I know a show like today will help many of those people get the help they need.
Right, absolutely. So we're going to put on our website information about the summit that they're having, so you can learn more about that. We'll also have other resources that can help you learn more about post-traumatic stress disorder. We'd also love to hear your comments or questions, so please email us at myhealthymind.com or reach us on Twitter or Facebook. And again, tune in next Sunday for more information that can help you live a better life.